Welcome, everybody, and thank you so much for being on this panel discussion. The panel discussion is in regards to the COVID-19 Go Back to Work course that we just created. Thankful for quite a few of the people on the call today who partook in authoring and narrating and collaborating on this course. First off, we have Natriece Bryant. She is the Deputy Director in regards to local affairs. She is the original author of the course. We also have Dr. Donald Voltz. Dr. Donald Voltz also collaborated in creating the course and also narrated the course as well. We have Dr. Sayegh, who reviewed the course, and we also have our strategic partner, AJ Rodriguez, who was impactful in having us build this course, as a matter of fact. So I wanted to go ahead and get some insight about what we do here at Avance. Avance Learning Solutions provides business training and online courses, along with a learning management system platform to house those courses. We've been in business for about 6 years. I also have a firm called Medical Academy, where we provide continuing medical education for physicians. That being said, we've created a few COVID courses for Medical Academy, and now we are looking into the business sector to help them get back into the workforce safely. So I'd like to go ahead and hand off the call to Natriece Bryant, who is the author. Natriece, if you can give us some insight on how important this course is to all businesses.
Thank you, Kimberly. Appreciate the time with everyone. As we all know, we have definitely entered a different time frame on reopening our states, reopening our businesses, and what that looks like. No one would have anticipated a year ago that we would be where we are currently. I don't think anybody anticipated a pandemic, and we definitely didn't anticipate our state shutting down regarding our business operations and also our governmental operations. So this course really talks about best practices in which to reopen. Depending on where you live, you might be a local control state in which your counties dictate how you reopen and your public health officials dictate how you reopen, but you also might be a state where the governor just dictates how the reopening model looks. But we really are looking to provide businesses with a best practice, and what that looks like is potential for making governing decisions. And how is this governed? How are we governing this from a business perspective? Is it staff that's making some of these decisions on what safety protocols look like? And if it is staff, how do we identify who our key stakeholders are? And so from a business perspective, one of the things that we always consider is our customers, but in this pandemic, we also have to consider our staff. And so it's not just determining what's safe for customers, is it mask wearing protocol that we put in place, but also for our employees. And so this course really is designed to communicate to business owners and businesses on best practices that they should utilize when it comes to reopening. Some of the key factors that we talk about are definitely the guidance in which people should utilize. If you're a food supplier, do you wear hairnets? Do you wear masks? Do you put up a protective barrier in front of employees' faces that have contact with other people? We also think about administrative staff who might be at front desk, for example, and have people who are walking into a building and may not have a face covering on at all. So what would be the best protocol to protect them? And I think between all of those, we really have tried to identify how we can help the healthcare sector, specifically, and the doctor can probably speak more to this than anyone. We have people walking into hospitals every day, and it's not a question of if they'll come, it's when they'll come. And so do we have capacity at our ICU beds? For example, in certain states, they have only 2,000 ICU beds across the entire state. So should businesses be really looking at ICU capacity to determine if this should be one of the things that they're looking at when it comes to reopening? And so we talk about that. We talk about identifying our key stakeholders. Who are those key stakeholders? What business frame are we actually operating in? If ICU bed capacity is full, can we afford to have someone else actually get sick and not have a place to go? There's also discussions in different states that are looking at alternative care sites. If the hospitals are at capacity, is there another location that someone can go to receive care? Or are they just supposed to quarantine for 14 days based on CDC guidance? And so the CDC has been really wonderful in providing us with information on best practices as a whole. But then we have, this course really allows for us to go deeper into the sectors that are actually impacted the most, our healthcare workers, the people who have been identified as essential employees across the board. And we have had food suppliers open this entire time. One of the huge things is we cannot have this pandemic enter our food chain, our food supply. That would be detrimental to what's happening in our country right now. And so this course is really designed to help with implementation. Businesses can obviously take this information and frame it however they need to for their own clientele. But the 6 feet social distancing guidelines that have been given by the CDC are key for us to stop the spread of the disease. Face coverings are key for us not to have transmission between bodily fluids when we're speaking to each other. And other things that have been put in place, such as practices that do not allow for us to actually reopen certain types of facilities. So there's been huge discussion about, do salons reopen? Is it safe to take my dog to a dog park? Is it safe for me to actually go out and purchase retail? Or do we have curbside pickup? And so all of these types of questions that have come to us from a state perspective, but also from a business perspective, are things that we have to take into consideration. And that's what this course is really designed to do.
Perfect. Thank you so much, Natriece. That was great insight about the course that you created. Thank you. Dr. Donald Voltz, can you give us perspective from the medical side and the fact that you narrated this course using Natrice's content?
Yes, thanks everybody for being on, and Natriece, very well done. I want to just echo that the importance of this pandemic, and maybe one of the most insightful things to come out of this pandemic from my standpoint was or continues to be the need for integration and collaboration between so many different entities. And I think one of the things that I have been absolutely impressed with being in the front lines in the hospital is how local businesses have helped support healthcare throughout. And for me, that has been incredibly rewarding because before this pandemic, I think we just don't think of the things we're not aware of. And one of the reasons I jumped at this opportunity to try to provide some insight from the healthcare standpoint for business owners as well as for employees and customers, if it gets to that point, who are looking for this kind of information, that it's out there and available. There is such an incredible amount of information that's being presented, and it's being presented from so many different angles. And one thing that I found useful in this course, and as I went through the narrated, I found it also useful, is that we have to realize and acknowledge the fact that we don't know a lot. I mean, we've now been in the United States dealing with this for just over 3 months. And we've learned so much, but we've got so much more to learn. And as Natriece mentioned, there's certain businesses that at this point we might not have the information to allow them to open up, or business owners or even employees might not be comfortable returning to an in-business office setting yet. And I think it's important to acknowledge that that's the case. And it's also important to acknowledge that we don't know, but we're going to try to figure it out. And we're going to try to do this in the way that's most safe and effective. I am very hopeful and very encouraged that we have ongoing collaboration between healthcare and businesses as we try to figure this out. And I think it's the sharing of information and trying to put things in context that I think is going to be continually important. One of the areas I think that we initially had a perception that we would have a lot of testing available to be able to say, yes, somebody was or was not infected before we go back to work. Well, we've started to realize that we just don't have the capabilities. I think we will get there at some point, but we've got a lot of hurdles, and there's not much in science and healthcare that is very straightforward. Much of the information that we've amassed over the years has taken incredible amounts of effort and incredible amounts of failure and respect from a research side to think that we can come up with something in a very short period of time to roll out to, 350 million people here or, around the world is just not realistic. So with that being said, that's not to be fatalistic or negative, but that's to acknowledge the fact that we have hurdles that we've overcome so far in this pandemic. We have more that we still need to address and overcome. And quite frankly, we're going to have more that we start to appreciate as we start to expand our economy, as we start to restrict some of these social barriers. We're going to see things, and we're going to have to uncover new solutions to stuff that we experience. So I think, again, this course is important initially to get business owners, to get employees on the same page, and to get people to realize that we have to do this together. We have to acknowledge the fears. We have to prepare for the fact that some of our employees coming back very well might get affected by this, or their families might become affected by this, and we're going to have some flexibility to deal with that. It's difficult. Listen, I can't imagine what the long-term economic fallout from this is going to be. It's astronomical. I see it within our healthcare settings. I see the real possibilities that we might have hospitals fail because of this. This is not a small impact to our nation or to the world. So we do have to figure it out. This is clearly historic. I've been in healthcare now for over 25 years, and I've never been exposed to anything like this. We still have not made sense completely of this disease and of this virus. So again, I'm grateful to be part of this course. I'm hoping that really this will probably be a series of courses, in all honesty, because I think new information is going to come out. People are going to come back with questions and say, how do you think about this? How would you address this given this situation? It's complex. It's uncertain. We don't know where it's going to go, but we will figure it out.
Very well said, Dr. Voltz. I really appreciate the insight and the narration and the content that you added to the course itself. As far as the course and multiple layers of the course, we definitely will be adding additional layers to this course. We're thinking now of a course that will help the emotional and social impact of employees going back to work, and PSD, if you will. So we're working with another provider to create that type of course for the medical side and also the business side, which is obviously extremely important. We all have to be mentally successful and feel completely 100% okay to do our best work. So on that note, I really appreciate you segueing into that topic. I wanted to go ahead and pass the mic to Dr. Sayegh, who is one of the reviewers. Dr. Sayegh, you're welcome to add a few comments to what you learned in the course. And obviously you are one of our other continuing medical education faculty members and facilitators, and your insight is very important to us.
Thank you very much. Thank you guys for having me here today. Kim, thank you for allowing me to be present here. I think first and foremost, it was an excellent course, very informative. I think it hit all the key points, particularly the key points in order to open and the safety measures that were necessary or are going to be necessary in order to open, for lack of a better word, successfully, safely.
Perfect. I'm going to go ahead and give the mic to our strategic partner with MyStar, AJ Rodriguez, if you want to give some insight about the course.
So I see this program being that framework, starting that framework, having the traceability all the way back to, a credible source that speaks one voice, right? Because that's been a problem. One voice, and is able to inform employers on how to interact with COVID-19. I come at an approach of protecting people. People are the most important asset any company has. So I see this as minimizing, especially if you inform people and everyone knows what they're doing and how to, at least they know that they need these things. If I'm a restaurant owner and I know I need dividers 6 feet across, okay, at least I have the information now, where do I go? Okay, I'm teaching them how to fish. Instead of giving them the fish, teach them how to with this framework. From there, they're going to have to, of course, there's going to be other courses to follow, depending on how much more they need in their industry and how to fish to tailor make. But the core principles I see are here within this training. And also, one of the biggest problems I see that we're having right now is the psyche of the American people. People are scared. Businesses are scared. People don't, who can they trust? Oh, we're going to go back to work in a week, 2 weeks, 3 weeks, a month, 2 months. Oh, it might be a year. So now we have this. We need to build a trust level somewhere. With there's a gap, and I think this really helps fill that gap by speaking one language, give them access to a governing body that may not even be legally enforced now, but it's coming down the pipe. But I think this is a good, baseline. And I think the most important things going forward, especially within technology, like as a virus morph, right? They start advancing, and they start being able to, fight different antibiotics. And as those procedures change, that we, continue to speak the same language and stay on top of how our landscape's changing, what technologies are there to help, monitor traceability within stores. If they're washing their hands. I mean, there's so many different type of technologies out there, and being able to bring these, solutions to the customers to help protect their, the people that are trusting them to be in the organization and work for them. So I definitely, I'm honored to be a part of this and to put my input and to definitely be on this call and to help with this any way I can. And it really does come down. Our very first thing is protect our fellow man. I mean, I really care about people. I care about protecting them, and I want to make each one that's on my watch least attracted to the threat as possible. That's my job.
Yes, thank you so much, AJ. I really appreciate that insight. That was awesome, especially coming from your business. So as far as the course, I think rolling it out as of yesterday was a really big deal. We do have a wonderful preview via YouTube, and we're very excited to have, again, all of you on the call. It's such a pleasure to have worked with you. I'm very excited to work with all of you again and roll out some more courses so we can keep the world safe. I was going to say America, but really at the end of the day, the world safe. So thank you so much for your time. I appreciate it, and take care. Stay safe.